So what we need, if we really want to drive down costs, instead of states competing for who can regulate the most, we should have states competing for who can regulate the least. That will drive down the cost of health insurance, and that's a good market-based proposal. And I can't remember the highest. I think it may be Massachusetts or New Jersey. So the Republicans need to reject individual mandates, and so far they've done good. The Liberty Movement, what I like to call the Liberty Movement now instead of the Tea Party movement, the Liberty Movement has basically made the Republican parties all say no on mandates. Unfortunately, Senator Judd Gregg got up and said yes to mandates not 2 weeks ago on Fox News. They need to say no to pay for performance. Unfortunately, Governor Tim Haltley got up on Fox News twice now that I've seen and supported pay for performance. They need to not claim that they're getting interstate purchasing when in fact they're getting bad interstate purchasing under this new model. Now, how do we get real reform? Well, it really is about markets and individual empowerment. Now, we all need health insurance. I don't want to live without health insurance in case I get a really bad, expensive medical problem. No doubt about it. But I want health insurance that covers me catastrophically. I want to have the money in my pocket to go to the doctor or the hospital or the radiology center and say, how quickly can you get me in? How can you spend the most time you can spend with me, and can you make it as cheap as possible? When I've got that dollar in my pocket, and I call around to the MRI center and say, can you do it for $500? Can you do it for $400? Can you do it today? Can you do it next week? They're going to compete for your dollar. That's market economics, and it works great. 20 million people now are covered by health savings accounts. Those people have seen their health costs go down. Those people still engage in preventative health care. There's a myth that only the poor can do this because that only the rich can do this because the poor don't have the money and they're just too darn stupid to figure out how to spend their own dollar. I hear that all the time. They're all myths. Health savings accounts, high deductible health plans. A great way to empower individuals, put money in your pocket. You demand more time with your doctor. Patients, in my opinion, are sick and tired of waiting an hour in the waiting room to see a nurse for 10 minutes and their doctor for 3 minutes. They're sick and tired of it. And then they leave scratching their head. Well, what did they just say? And why do I have 5 more prescriptions? Why am I getting 6 more tests? Why do I have to come back here to do this again in 2 months? That's all nonsense. And that is what is come from a third-party payment system. When you have money in your pocket, and I say to you, I'd like to do an MRI on your neck, you can say things like, well, can you please explain to me exactly why I need that MRI besides you just said so? And can you help me find the cheapest place? And I might say, you know what, I'm really doing it to cover my butt from a lawsuit, which happens all the time. And if you trust me to be a doctor, I'll probably be right 99% of the time, and I'll just write down on the chart that you were informed and decided that you wanted to try trusting me as a doctor who knew what he's talking about. And I'll see you back in 3 months, and we'll talk again about your neck pain, and probably it'll be gone. Just like I predicted it'll be gone, and you don't need an MRI. I've had this exact conversation with several of my patients with health savings accounts. Other things are interstate purchasing. When governments compete to regulate less, costs go down. Competition. Richard Nixon did us no favor when he created managed care and HMOs. He also created something called a certificate of need. Right now, the government panel decides when a hospital is going to get built. And guess what? The hospitals that already have hospitals, they don't want that to happen because that's a competitor down the road who might take their business away. So you go through this lengthy bureaucratic process. So instead of me opening up a focused factory spine hospital where you can come in for a day or two and get spine surgery and leave at about 20% of the cost and happier and have like lobster instead of bad hospital food, I can't do that. Not in Florida and not in the vast majority of states. There's like 7 states that allow it. Oklahoma, I think, is one of them. We need to get rid of that centrally planned thing and put competition in. When people are competing, you'll get more of what you want, and the price will find the natural level. When you look at LASIK eye surgery, people are not covered by insurance for that. The cost of LASIK eye surgery has gone down. I haven't seen many ophthalmologists driving 75 Pintos. Okay? I haven't seen a lack of ophthalmology services. The costs have gone down. The doctors are happy. The patients are happy. There's more of everything for everyone. Plastic surgery costs have gone down because it's out of pocket. All right, we have people competing on Bubble the Love Sponge about who's going to do your breast augmentation, for goodness sake. It is competition, okay? It drives down costs. There's great work on this on Cato Institute. Tort reform is a no-brainer. I'm not going to spend a great deal of time about it. We have a runaway lawsuit system that drives up costs. We can have a lengthy debate about it, but the trial lawyers are controlling the Democratic Party, so that's not going to happen. Howard Dean said so. All right. I want to spend just a few minutes on local government. Your local governments are just as bad as your federal government. All right? And when we looked at the property taxes, and when Marco Rubio helped me and a few others create a property tax cap, we did that in 2006. We put a constitutional amendment for it. We fought real hard. We didn't win. But Marco Rubio, for 2 years in a row, got that passed through the state house. When we did all that, we looked at the local government budgets. They were collecting more money than they ever could dream of. And what were they doing? They were creating more spending than anyone could ever want. And we looked at those budgets, and here's where, after lengthy analysis, and we don't have time to go into it, here's where I found the 4 common areas for government spending, where I would ask groups like yours, go to these governments and hold them accountable and demand that they cut. Number 1 is corporate welfare. It is not governments that create jobs. It is not governments that decide that this company should win and get a $5 million tax subsidy to come here, SRI in St. Pete, or I think big pharmaceutical company near Moffitt. Government should not be taking your tax dollars and gambling with it. That's how we had failed cruise ships. That's how we have a pier with a $50 million price tag and millions a year. That's how we have the Tampa Bay Rays getting $2 to $3 million a year for insurance on the dome and free police security at every game. And your dollars on the line, and now them blackmailing us. That's called corporate welfare. Corporate welfare not only wastes money directly, and some like to call it economic development, but it also creates a powerful political elite and special interest cabal that think they know better than everyone else, and there will be winners that they decide on, and there will be losers, and they don't care who they are, as long as they win. Next one is failed social welfare programs. You look at public housing, you look at subsidies to Graham Logos and those poor people just thrown out or being threatened thrown out on the street. Those programs fail. They don't work. There is no government program that can solve homelessness or poverty or any of it. There are roles for government. There are roles for them, but I would suggest there's bigger roles for charity. And charity has suffered tremendously as people send their dollars to big governments. And they think, well, government will take care of those folks. I don't need to do anything. And then the people in those programs, the social welfare programs, just take the money. There's no accountability to people. They don't have to go to their church or a local group in their community and look them in the eye and say, I am finally pulling myself up by the bootstraps. I'm not going to be on the dole forever. Charity needs to come back. Failed, government waste. I mean, we see it every year. I drive down 4th Street or 9th Street in St. Pete, and they're resurfacing the darn street again. It's like every year or two. They're resurfacing. You know what they did at 22nd Avenue? They resurfaced it so many times. They couldn't just patch a pothole. Well, they have to have people leaning on shovels, people, getting government, money to have their government job, and they're paying people off to have these jobs, by the way. That's how they get the votes. They resurfaced that street so many times. Another government street program. We're going to raise the curbs now. They go down and they raise the curbs and they redo the sidewalks. I mean, I was looking down 22nd, I'm driving down, and I'm almost driving onto the median and into the gutter because there's no curb. You mark my words, I'll be raising those curbs soon, and just many people will be leaning on shovels and staring at the other guy working. Government ways. They replaced stop signs in my neighborhood, for God's sakes. They drove around in a systematic way, A to Z, replacing stop signs. I got one of those stop signs in my garage. I love holding it up in speeches. Perfectly good stop sign!